This segment of Delmarva Life is brought to you by Delmarva Dental Services.
Whiter, brighter teeth, it's what we all want. It's what everybody in Hollywood has. But how do you get them?
Well, if you go to the drugstore or supermarket, you'll find hundreds of products that claim to whiten your teeth. Well, what works? What doesn't? Dr. Joseph Harmon of Delmarva Dental Services enlightened me with a little whitening 101.
Teeth whitening goes way back.
For thousands of years. Egyptians have, Romans have, Greeks have. That's something that's been important to people for a long time.
And today it's no different. But Dr. Joe Harmon of Delmarva Dental Services says the business of teeth whitening is a very confusing one.
The consumer gets really confused. I mean, I've been bleaching teeth for years and years and years and years, and I'm even confused. But I researched it, and there's people claiming 1 minute whitening, instant whitening, 5-minute whitening, 30-minute whitening, 1 hour whitening, and the consumer really has very little way to judge.
So not only is he giving us a lesson in teeth whitening 101, I get to find out how easy and effective proper teeth whitening can be. Dr. Harmon says there are 3 important criteria. The first is time.
So no matter what system you use, the longer you have something there, the whiter your teeth look.
The second criteria is contact.
If it stays on your teeth, it works better. So if you paint it on your teeth and you don't have a tray, it's going to run off. So the better contact you have with the bleaching agent to the tooth.
He says that goes for whitening toothpaste and mouthwash. And when it comes to trays, there are many choices.
There's stock trays which fit very loosely, and you can buy them in the drugstores, and they're made to fit everybody. And you can also buy them on the internet, and they're fit loose, and the material, the bleaching solution runs out.
That's why Dr. Harmon says he prefers custom teeth whitening trays.
Custom trays fit so well that I've actually swam laps in a pool with bleaching trays to see if they would stay in, and they did.
In order to get my custom trays, I had to have molds of my teeth made.
The tray is made to fit in those spots. Okay.
Dr. Harmon says whitening strips can provide the contact, and he uses them in his practice, but says they don't stay as secure as the custom trays, especially on the bottom teeth.
So it takes a little bit more manual dexterity to do the whitening strips than it does the custom bleaching tray.
The third criteria is the concentration of your whitening agent. They can range from 2% to 46%. But Dr. Harmon says you have to be careful. Whitening agents can cause temporary cold sensitivity.
Sometimes we'll use 10, sometimes we'll use 16, sometimes we'll use 22.
Dr. Harmon says you can get a quick whitening with a laser, but it has to be used in combination with trays or whitening strips.
Laser bleaching is like a jump start. Let's say you got a wedding the next day or 2 days from now. Then you would do laser bleaching, and it would be nice to have the bleaching trays too.
And Dr. Harmon says don't be fooled by teeth whitening claims to lighten your teeth a certain amount of shades.
There's no universally accepted shade guide, so that doesn't mean anything.
So remember, time, contact, and concentration, all important steps to a whiter smile.
And now Dr. Harmon took before and after pictures of my teeth. This is after only about 5 days, so you can just imagine what it's going to look like. Dr. Harmon mentioned the quick whitening visits, you know, the ones where you're in and out in about an hour. He says it might look good after you leave because the drier your teeth are, the whiter they look. And in most of these places, they shine a light on your teeth, thus drying them out. And Jimmy, I have been using my custom trays to whiten my teeth for a while now, an hour a day. And I have to say that after 2 weeks, I definitely notice the difference. Do you?
I can see it, yes. Gorgeous smile, gorgeous smile.